Hello, everybody. Good evening. This is Dr. Rao. I have been talking about uh, proactive wellness quite a lot these days. It's more like a obsession of mine, probably. You can consider that because I want people to be avoiding illnesses and complications from the illnesses, chronic diseases, and what's involved in that suffering. Okay, as a healthcare person, um, had been in practice for so many decades, and also now know about the ancient ways of healing and being healthy. I think it's about high time that we, being so advanced in scientifically, technologically, even cultures of wisdom with so many thousands of years of history, uh, I think it's not intelligent not to be proactively well. That means you are going to anticipate a lot of conditions, uh, maybe some hidden diseases you may not be able to, but with the editing and other technologies that are developing, probably we can do that also in a significant way. So I want to be really addicted to the proactive wellness campaign, and I think that's a service I'm doing, and it's impending on me to do that. To promote people being not only just preventive, but being proactive about simple things, right? So we all know what I've been talking about, uh, the comprehensive self-care, which I talked about for so many decades now, about how we can take care of our body and mind better by just having a nutritious diet and optimal exercise and quality sleep and developing a calm mind as we practice these simple lifestyle changes, right? I call them therapeutic lifestyle changes. So today I'm going to preview what I'm going to talk about uh, tomorrow about holistic health for healthcare pros. If you really take the numbers have been awful. A lot of people have been burning out, and more importantly, they're silently suffering too. The healthcare practitioners, that it be physicians or nurses or pharmacists or anybody connected with healthcare, they're really uh, they are low on the revenue on one side and high on the workload and high on the stress and burnout. And there are still some people ending their life because of the burnout. Okay, so this is not fake news or anything. It's actually reality in several health systems. Okay, uh, I think that's because people don't give enough attention to their own self-care. They don't have to be selfish about it. Rather, they have to be responsible about their self-care. So I've been talking about this, and I have been helping people whoever reaches me. And these talks also are meant to inspire people and get them on this very private self-care that they can do on their own with so many resources available. You can know about the vital nutrition, you can know about the exercise, you can know about uh, uh, sleep and calming the mind and all that. There are so many online resources. I'm bringing in an app also. It's called Be a Pal to Real Wellness, where you can customize your own diet, your own exercise, your own sleep patterns, and your own meditations or whatever, right? So mine is not all. There are so many online resources if you want to do it. Okay, of course, people like me who are wellness advocates or wellness optimizers, you can call us that. We may be physicians, we may be coaches, health coaches, any number of things like that. Okay, so you can reach out and get our help. We will be more than willing to really participate in your comprehensive self care. I wrote an ebook, I wrote a course, I wrote books on that, but that's not important. What's important is uh, healthcare workers or physicians, nurses, and all, they are leaving the profession in drones. That is a fact. So it is anticipated if you lose these pros at the current rate that we are losing, uh, it will be a situation where it could be a national emergency for healthcare providers. AI probably would help the situation in a bigger way, but still, art of medicine and taking care of the patients always will involve uh, healthcare professionals that need to interpret, that need to interact, that need to have a human touch and all that. Those things are not going to change. Okay, people are like people. People need other people to really talk to them and heal them. That's a given, right? So I anticipate a lot of replacements to the um, doctoring, like as far as concerned um, with the supercomputers that we have, with the AI evolving into already we have Dr. Gupta's site, which is for the medical people to relate to the other lay people. It's not CNN Dr. Gupta. This is Dr. Gupta's site that is being experimented, and then. There are so many ways you can interact with online and get the preliminary primary help from the computer rather than you can call. See, when I really entered the profession in this country, for everything they have to call us. The doctor has to give every small prescription. To now, there are a lot of things are done by the nurse practitioners, the physician assistants, and even the walk-in clinic like a CVS and other pharmacies have evolved into more convenience for the patient, more accessible for the patient, and less demanding time for the physicians. In the process, they may not be doing unless it's a very specialized care that they could do. Most of the regular, ordinary, day-to-day primary care things will be replaced by the computer. That's a fact. And then I have accepted it 10 years ago. So I have no problem. I did tell about uh, patient and physician being equal in my lecture on hymns where I did one in Iowa, Des Moines. I said that and they were surprised, but that is true. Patient and the physicians are equal, in the sense that you got to listen to the patient, and then patient has every right to ask questions and also participate in his own care. I really, to the heart, I believe that, and then as a professional, it's my responsibility to be current with the what is going on in the research. But then now that is also being given by the so you don't have to take it, you can ask it, give me some reference, give me some studies because of you're suggesting this to me, and chat gpt or bing or anything can give you references based on which they kind of give you that advice. Okay, so it's going to be a remarkable change. It's going to be good for us in the sense of uh, uh, dissemination of information. But of course, there's always room for the fake, and also there's always room for misinterpretation. There's always room for not appropriate for that age group or this person. That is where the art of medicine is still going to come, and you may have to know. For example, uh, there was a patient. She has allergy to ativan, temazepam. So, that's an anti-anxiety oral agent. But she had history developing allergy in the terms of rebound anxiety for her if you give her that. But then she ended up in a hospital. They didn't know, and she was not in a mental state to convey it to them. And they gave her Ativan, and she went to berserk. And then they got hold of me because I'm her primary care doctor and knows her a long time after the fact, right? And then immediately said, "Oh, you should not have given her that. She's allergic to that." That is documented there, but they didn't bother to check that. So that's the kind of things happen in the absence of art of medicine, where you know the patient, you have personal touch with the patient, you are interpreting unusual symptoms that can happen to only certain patients, right? So that is there. But in general, if you're looking for common conditions and common protocols, you will fit out just by you asking some questions, right? That's already happening, and it's going to happen more and more, right? Remote surgery is happening, remote microsurgery is happening, and remote assessment of somebody's condition that is happening. So many ways we're going to improve the remote care. So in this scenario, the people who are going to work will have less income and more work coming their way, and then less appreciation also. So, the good recipe for people to feel burnout and also not to come into the profession at all. That's the danger. Okay, I I really think still there's a lot of room for having enough practitioners that will guide the system. So even if you don't have many people, the few people who are there probably would end up with a lot of more work and then more burnout too. And that's why voicing the means that we have for this holistic health care, comprehensive self care is important. That's why I'm doing that. And still, the current generation is not doing enough for their self care, and incoming generation are anxious about this. That's why I thought it is our duty as senior physicians had been there for so many decades, pass on some of the wisdom that we learned during my practice years, and they also I kind of have more responsibility because I have seen other healthcare systems, healing healthcare systems, and I practice it personally. That can really help us to develop that inner resilience to thwart all the challenges that we face in the healthcare system. So, simple deep breathing, developing non-reactiveness to trivial things during the day, and also unwinding a little bit, and then doing this deep breathing practice through the day. All these things help me. Do they cost me anything? No. What I need is a little bit of awareness, a little bit of persistence on doing this deep breathing, and really watching my reactions and understanding them and going beyond them. All that is possible without spending a penny, right? So that's what I advocate and I teach all the time. I practice it too. People ask me, how do you have energy at the end of the day? I say, don't waste it. Don't deplete it in negative thinking, toxic thinking, or somebody doing something. Be happy for them. Don't be jealous of them. All those negative emotions, right? It's very easy to do that. People don't do that. But be keeping these things in head and not going from one theory to other theory, one speaker to other speaker, gathering more and more information. What are you doing with the information that you have? That's important, right? It's not just listening and say, oh, yeah, this is a good point. Oh, that is a good point. Oh, I read those studies. I read this. What's the point? You got to bring that wisdom into action, right? Just showing off their intellectual prowess or memory That may be okay for silly people, but then most of the serious people will not take that much that serious. Okay, what we want to see is wisdom applied in real life. Okay, then it should show in your life. It should show the inner resilience. It should show the joy of servicing patients. It should show the joy of really solving problems for the patient. All that. Say, I may be naive. I may be, altruistic in that, but that is what I like. So if somebody is really not suffering, is good. There is a word called mudita, that is from the master of mind, Patanjali. Actually, he said the yoga is for the mind. You have to get the body healthy to have good mind, but then basically mind. In that, he describes one of the happier states that we have as human beings is this mudita. There are other things, so maitri, karuna, all those things. But then mudita is a feeling that you suppose you are going in a hospital and you see somebody had resolved a difficult case, complicated case, having problems, and then you are able to master through them. Then you say uh, you will be happy for his prowess, for his uh, capacity, for his ingeniousness, and all that. You are happy for him. That is called mudita. Cultivate that, see what is happening around you and appreciate the effort involved and then go and congratulate them, go and encourage them. See how that feels. It feels really achieved. You are not in competition. You are not really saying people that you should be like this. But you will be appreciating whatever they have achieved, right? So that helps us a lot. That is called mudita. That's a quality of enjoying other people's success. Okay, so all your negativity is gone if you are like that. Okay, more than competition, collaboration breeds more cooperation, right? So that, but then the society breeds competition, one upon other people. Then you are intellectual arguments, one upon other is silly, but then people do, very learned people also do that. So understanding these reactions in the mirror of the relationship of with the society, with the committees, with the patients, our patients' relative reactions. We may react like that. We cannot just say we are silently inside. No, we may have the reaction, but don't let it go. If you are in that self knowledge, I want to know about myself, how I react. You may have background of why you have become like that, but then not looking at it, not reflecting on it, and not trying to really get over that kind of thing is something detrimental, right? But in the evening, just reflect on whatever happened in the day, major things, minor things or trivial things. Dump the trivial. Minor and major, maybe you kind of think over and see the validity of the wiseness about these reactions. And then, if the reactions are legitimate, you are fighting for a cause, you are fighting for a truth, or you are trying to establish some bad practice by somebody and you want to prevent it, fine, that's fine. That is a resolution of that. But then, if they are problems of your ego, it's a question of really finding respect through egoic exaltation. That's not healthy, and it's not healthy for you or for your team or for your hospital, anything. So you go over those reactions and then end them, learn about them, go to the circles where the wisdom is there. For me, ancient wisdom, you can go to places and immediately I get quenched of that. In the morning hours when I spend time for my elevated thoughts, I call them. There are so many things that come to mind and all that, and then the purpose of life, the importance of being kind to people, all those things come. Then you elevate your thought from self-centeredness to from the smaller self to bigger divinity that is present in all of us, which is equanimous, which is embracing, welcoming, and really making room for this mudita, friendship, and kindness, and all that. That is elevating yourself from the self-centered lower self to sensory based to higher self that is based on your real intellect, understanding of life, and elevating yourself from that is a very, very valuable thing. In the evening, you review reactions and clean up your mind. In the morning, elevate your thinking. That formula works for me very well, and I teach my friends who are burning out as stressful. Okay, human life is not just about doing stuff; it is doing that part of a responsibility. But just because you go there and you work a few hours, some work, whatever work you do, that's not enough. In that process you discover a lot of wisdom, and then you implement them as best practices. They do it for a mechanical thing like you know how can I nail these nails firmly into the wall. They have best practice about that manual. But what about the inner self of human beings? What manual you are using? What kind of wisdom you are relying on? For me, ancient wisdom. What about you? That is the question that you want to entertain, right? And then once you have found that inner wisdom, you don't have to study any books. That is there. The innate wisdom of ancients is there with us. But there are so many ways of learning that. The resources are there. I found them so many, very, very old. One monument I found was 18,000 years ago. 18,000 years ago. So it's a document which starts with uh, all the immunity enhancing behaviors that you could do every day. I remembered them like this. Maybe other people heard me saying this, but I will repeat them again in case anybody did not hear from me. Okay. The number one, I kind of put it like a from night till morning what I do, right? At night time, I want to have a deep sleep where I do cleaning my mind and all that, right? I want to sleep on a empty mind, or if that is too much, maybe positive mind. That means you can recall maybe three or four positive things that happened with you for the day. Like don't repeat something happened long time ago, but happened now because it is fresh and you want to reinforce it. It's much easier to remember and all that, right? So uh, think of three or four positives and sleep on that, and sleep good. Maybe 4 to 6 hours of deep sleep. So good quality sleep, number one, right? And then you get up in the morning, you want to remember, I don't want to be lazy about getting up. Put an alarm, 6 o'clock, it runs, then you shut it off and go to sleep again, wake up at 8 o'clock. That is lazy. Okay. So, resolution for you beforehand that I'm not going to be lazy when I get up would help a lot. Okay. You can do that slowly, but it will help. So, absence of these are written there. That's what I'm telling you. Uh, Good quality sleep, and then number two is absence of laziness. Okay. Actually they put in an order first, different, but I wanted to remember, that's why I kind of placed it like what I do from night till morning. Okay. And number three is go to the bathroom and have a easy bowel movement. Number three, that's healthy. Nowadays we make a hoopla about microbiome, all of that. But then we were always taught about taking yogurt with his probiotics. All those things are there now. But then simple diet involved always finish with the yogurt, right? So that what we call tradition carried on into the regular life. So number three is having a regular easy bowel movement. On the way back from the bathroom, check your weight so that it is not too much, not too little, but it is in the range that you are supposed to be. A general rule is if you are 5 feet 6 inches, for example, 5 feet 100 pounds, and for each inch after that 5 pounds. Okay, so 30, that means 120 to 140 is your range. So make sure you are there. You are not doing too much eating, too little working, and gaining the weight. So you can watch the weight, not in an obsessive way. In like in America, they are obsessed with the numbers, But it's the behavior that's needed. Then you don't have to really check the weight. It should be stable. So deep sleep, then absence of laziness, easy ball movement, and the weight, right? Then you go and expose, you go out for a walk or something, and then expose your skin to the sun, okay, and have the walk. Six one is that, and then when you come back home, have a good appetite. That is something. And then have a good, nutritious breakfast. This seems so simple, but then how many people are doing this? I check every day. Oh, I had a good sleep. I have not dizzy in the morning. I had a good bowel movement. I had my weight is. I don't check it also. I know that it will be okay. Once in a 3 months, 4 months, it's still 150. It will be there, and then. I kind of expose my skin to the sun somehow. If it is very cold outside, if the sun is coming. I have big windows in my study, in my front room, and all that. So I go and stand in front of them. Where that is how the sun comes that way in the morning, and then expose myself to the at least half an hour, right? And then. I do yoga and breathing, which gives me good appetite, or I do exercise with my wellness club, and then have a very good, nutritious breakfast. That's important. All the essential nutrients should be there, packed, right? And then you can do all the other things that you want to do. So these are the 8 things that they talked about. If you do them on a regular basis, your lifestyle is like that. That means if you want to have good sleep, go to bed early, and also unwind before you go to bed, and also understand how can you have deep sleep. Okay, not by drinking alcohol, those are no, but more like understanding what is the reticular activity, how do I become all these things. Once you So all these important things that you bear attention to, then you will be sleeping very well. Okay, that's a whole topic. I did that. If you want to go to search my talks, and it will be there. What is the pre-sleep routine? What is the post-sleep routine? What is the daily basis of going deeper and deeper into sleep, and when it will become not pathological, but more like a revitalizing your body and the mind. Okay, so you can also work on your laziness. For example, there is this quality of tamas, right? That's inertia, laziness, and all that. That is needed when you need rest, when you need sleep, but it is not needed during the day. So a lot of this happens because of the creature comforts that the modern people have got used to. Get away from them, work on them, find out what is the truth about it. Do the creature comforts really make me more lazy? You can look at that one. Okay, then you can see, am I having a lot of fiber, a lot of water, so that I have easy bowel movement. And there are yoga things that we Pavana Muktasana or Bhakwana Buddhasana. So many asanas are there that promote better bowel movement. That's a chapter there too. So for each of these 8 things, if you do them like a regular things for you, and then correcting what is impeding that kind of thing, then you will develop a good immune system and good inner resilience system, and also your diurnal rhythms, the cycles that we have, bodily cycles every day, 12 hours. First, you get fasting and then appetite, and then you eat when you have the appetite. You digest is better, absorb, and the waste products are produced. And then once they're gone, then you have appetite again, and then you will eat. That cycle, not like eating whatever you see, wherever you see, with whatever whoever says, and without paying attention to that. So you got to have a kind of discipline about these things, not enforced, but then understanding and leaving the body's intelligence to do its own cycles. It is much more intelligent than your information laden mind. So just because you know a little bit, you think I'm so intelligent. No, the body intelligence is such a phenomenal thing. It remembers everything. It kind of, if you allow it to go off track, then it will lose that. Okay, that's why you have to understand what are those energies, biological energies. There's a tamasic, which I told you about, laziness; rajasic, which is active energy, which is too much, that's not good. And then there's the sattvic, which is the balance. All that. So understanding all these deeper principles of ancient wisdom would help us modern life to be simple but effective, but very intelligent too. Body intelligence is such that, a simple example is typing. When we are first typing, we will be looking at each letter, hunting for that, right? And later on, that becomes the memory of your fingertips, and then they will be flying on the key without you looking at it. So the more you do it, the more it will develop that finger memory. Okay, thereby you don't have to spend much energy. Body has the intelligence in so many ways. If you don't understand and you interfere with it with your own intellect driven habits, then it will lose that intelligence, body intelligence. So listen to the body, be in touch with the body, then you can train it. And that's like a big elephant. If you train it, it will behave well. If you don't train it, it will crush you. Okay, so that kind of thing. So review all these 8 points. See how many you are doing, how many you are not able to do, and go and find out what are the reasons in your own way. You don't have to consult anybody. You can just see, "Yeah, why am I lazy?" Then you can find out the reasons when you started to be lazy as a youngster, and what do you feel that is very comfortable, and that is the one which reinforces. Okay, sitting on the sofa, putting the legs up, and like an old man, if you start to doing it from you are very young, then your body will learn that, right? So creature comforts are a real reducer of longevity. You cannot live longer if you allow these creature comforts destroy your normal intelligence of the body. Okay, so I'm very much against soft cushions and comfortable beds, and not comfortable, very low spongy beds, and also um, this easy chairs when it's not appropriate. Suppose you're on beach, you're relaxing, that's fine. But at home also, you want to sit down and watch TV hours and hours and hours. Uh, you're doing exactly opposite. You're supposed to move the body and keep the mind quiet. But we are doing opposite. We get caught up in the Amazon movies and all that, right? So that's the cultural thing that we bred without really, and then there are forces who are to sell us these things so that they will make money. The McDonald's, the comfort chairs, the chairs that are not good for you, so many things they promote, right? So anyway, I don't want to go ranting about it, but that those 8 things I think is worth taking a look at. This was written 18,000 years ago, and the authenticity also I believe, because those people who kind of found it and sent it, it's all in Sanskrit. But once you translate it, these are the things. So I know a little bit of Sanskrit. I can read it, but then explaining that in English is much easier for me to observe, right? So Sanskrit is a beautiful language. I regret I was not given full benefit of that when I was growing up. If only they have taught me, I would have been probing into ancient wisdom much more. Even now, I'm doing that. There is one book called Charaka Samhita, and in that they talk about lots of stuff, and they are very good in that sense. It's like how you can improve your immunity is a big problem, in Asian cultures generally, and they have preserved it somewhat, even with all the onslaughts by other cultures and destroying them. They still have a lot of traditions left in regular life. We can take some hacks. I'm not saying everything that they do is the only way. No, there are a lot of modern ways that are pretty good. Ergonomically designed chairs, right? So they have seen the back problems of so many people, and they have seen so much, suffering of the employees and also loss of money for the corporations. So I'm a big believer in that back supporting chairs. And in 80s, I had this back supporting chair in the sense your knees are bent in the front and then your feet are on the floor, but your seat will be on this inclining small chair without any back support. So you are forced to sit, straight on your knees, and on your feet will be on the ground. That was a very good chair. I used it for decades. Later I think it broke, and then they kind of took it away. But then I have other things that are keeping my back erect. I don't lean into that as much as other people do. So even in the cars also. So the whole redesigning the furniture that can help us with our posture, with our laziness, with our protecting our back and all that. So anyway, some of these things I'm going to talk about it tomorrow when I talk about holistic health for healthcare pros. In the morning hour, 7 to 7:30, when I do that, and I'm starting a new series either on this hour or later. Maybe 8 o'clock will be better than this hour, and there I'll be providing one tip a day on the weekdays. So 5 a week and 20 a month and 60 I have right now. Maybe more come up. I don't know. We'll see. Those 60 tips we will present one a day, but the emphasis would be inviting people to come and share their take on that tip. Either they are familiar with it, they are using it, what is their experience, what is their opinion about it, or they don't know and they can ask questions, something like that. More like a little bit encouraging other people's views on those tips. Leisurely, we will do that. So that's what I was planning. 60 tips for 3 months, probably starting on Monday, maybe at night time, 8 o'clock. I will start doing that, or maybe in a couple of weeks, because I'm having this retreat coming up. The retreat was planned for a couple of months now. I have been telling about it. I think it's the 19th or 20th, something like that. The topic is about how to survive information age and using hacks from the ancient wisdom. Information overload, brain fog, or insomnia, or any gastritis, or depression, anxiety, so many problems raising out of too much reliance on the technology and too much away from the nature, and a combination resulted in a lot of neurotic people, lot of anxious people, lot of depressed people, and suicidal, aloneness. So all these things are kind of, people don't pay attention. They grow into small and then bigger problems later. But if you can identify the reasons why, and then you can change that, I think you have better chance of handling these things by yourself. You don't have to see therapists for these things, but that has become the fashion. But in yogic science, it's all about inner resilience, depending on ourselves, self knowledge, and then changing things from that perspective. So we are intelligent human beings. We have a lot of knowledge, lot of wisdom. Use that. Be aware of that first, and then use that. Okay, that kind of thing. So we're going to talk about those tips and the wellness tip, one tip a day. That's what it is. So anybody wants to come up before I hang up this thing? You're welcome to come up. Okay. All right. Somebody wants to come up. Yes. Hakim. Okay. Very good. Hi, Hakim.
Hey, Dr. Rao, how are you doing?
Doing good.
So, of course, I appreciate the subject,
Yeah.
um, holistic health and healthcare pros.
Yeah.
Um, being that I'm in that field myself, of course, I'm not a physician, but being
Yeah.
a fitness trainer,
Mhm.
teaching self-defense,
You're
all
a
of this stuff
healthcare
is,
pro. Yeah, you're a healthcare pro. No
I'm a
doubt.
yoga teacher,
Yeah.
um, and a lot of times, one of aspects I wear is as a clinical hypnotist, and
Yeah.
often that's considered to be part of a holistic health system.
Yeah.
And
Hmm.
um, when working with certain clients, we work closely with physicians because, first, especially if there's an abnormal psychology or some kind of medical condition, as
Yeah.
a lay hypnotist,
Yeah.
we have to have a referral from a physician or a psychiatrist or psychologist in order to work with certain clients.
Sure. Sure.
And that's part of what makes something holistic is that
Mhm.
you have on one hand the psychological, psychiatric, and medical,
Yeah.
and then you fill in some of the gaps with something like um, clinical hypnosis or
Yeah.
even different spiritual means like different things in metaphysical sciences and understanding,
Yeah.
meditation, prayer, and various other practices
Yeah.
that would make it more holistic. Of course,
Yeah. It's
the term
it's
holistic
like a
meaning,
team-based
yeah.
approach. Yeah, definitely.
But I like the term also integrative
Yeah.
and complementary as well, because sometimes people use alternative,
Hmm.
but like Dr. Andrew Weil in
Hmm.
Arizona, he talks about, for example, complementary,
Yeah.
instead of it being alternative. So because it's more inclusive.
He was the
So,
one
but
of the
thank you,
first to
yeah, Dr. Rao.
advocate.
What's
Yeah.
that?
He was one of the first to advocate that, Andrew Will.
Yes,
Yeah.
yes, he was Andrew Weil. Yep.
Yeah.
Great, great physician.
Yeah.
I thank you, Dr. Rao. It was good talking to you.
Yeah.
Thanks for letting me up on your show today.
Sure, Kim. Absolutely. Integrated is the way to go because we don't have to sacrifice one for the other. Kind of integrated wisdom from modern medicine and the scientific breakthroughs and ancient wisdom. If you look at uh, one way or other, if you say, I'm only this, then you are missing out on the positivity of the scientific breakthroughs or, what is the wisdom in the modern medicine. But then a lot of modern physicians are close to the ancient healing systems that survived, that treated thousands of years. Even now, if you go to several corners of the world, they may not afford the modern medicine construction and getting medications and all that, So they do rely on the ancient systems. So some of them may be superstitious, some of them are their own beliefs, or some of them are their minds are taken over with this wisdom in the system, and that acts very well. Yeah, it is there. All right. Anybody else before we leave? All right. I will see you. I think it's almost 7 o'clock. That's when I end the thing, and then I go and spend time with my family, and we have our own fun things to do. And then we'll see you again tomorrow morning. Okay. Thank you. Bye bye.